You're waking up refreshed with local and national headlines. Back to Houston's Morning News.
Indeed. Bob Franson for Matt Patrick, 717. We got traffic and weather coming your way in about 2.5 minutes. Let's talk more about healthcare and what you can and can't do thanks to your insurers, and also thanks in part to Obamacare and the limitations put on what you can get covered. A study released by the National Center for Health Statistics say Americans love complementary healthcare, alternative healthcare, things like acupuncture, chiropractic, etc. And they're spending $30 billion to do it. They're just not covered by insurance. That's about 1% of the total healthcare expenditures, but a big out-of-pocket cost for Americans. Dr. James Pinkney, Diamond Physicians, joins us this morning. Doctor, why do you think these alternative healthcare approaches and treatments are so popular among Americans?
Good morning. Well,
good morning, Doctor. I'm sorry. I went right to the question.
Well, the customer experience has been completely lost in healthcare today. Typical patient wait time is 45 to 60 days to see a primary care physician and up to 3 to 4 months for a specialist, with the average visit time about 8 minutes. And that's not enough time to accomplish anything. So consumers are migrating to alternative therapies because you typically will have 45 minutes to an hour with the therapist, whether it's acupuncture or chiropractic manipulation, and you have that customer experience. And that's really why I founded Diamond Physicians, to reinvigorate the patient-physician relationship, completely revolutionize healthcare delivery, and start getting back to the basics, and that's the consumer.
So what, obviously, by the way, I'm a big fan of chiropractic. One of my most treasured things are my visits monthly to make sure that I'm adjusted. So I completely agree with and support many of those approaches, but it's expensive because there is a very strong limitation on what my insurance plan covers, and I know that's the same case for everyone else. Why do you think it is that insurers are so hesitant to cover this sort of care?
I think the metrics aren't there for these therapies yet to reverse chronic disease, and that's what they're about. They're about saving money in the long run and mitigating their risk for catastrophic claims. And it's acupuncture and chiropractic can help reduce pain and solve some acute issues, but when it comes to hypertension, hyperlipidemia, diabetes, you're not going to get much bang for your buck with those modalities. So remember, the insurance game is all about long-term risk. So they want to put money into things that they know that can curb long-term risk.
And that certainly is understandable, but the pain management that you just talked about is very, very important because, as we all know, the rise of opioids as a drug of choice for so many, particularly when you get into heroin, sometimes it starts with people being forced to use really, really powerful pain medications to manage their pain, and it gets them hooked, and away they go. We all know the drill. If they can find a way to manage pain without having to use as many drugs as possible, you would think that would be something that would be beneficial.
Oh, absolutely. It's very beneficial. But I think we should go to a membership medicine model where consumers pay a capitated rate, one monthly fee that includes all primary care and holistic services. That way, you can receive as many acupuncture sessions, as many primary care sessions, as many chiropractic sessions as you want. And we use insurance for catastrophic issues. So we should use our medical insurance like we use our car insurance. When you fill up your car with gas, you swipe your credit cards. When you need tires, need windshield wipers, you pay cash. If you get in an accident and it costs thousands of dollars worth of damage, that's when you file an insurance claim and you pay your deductible. And that's why your car insurance premiums are relatively inexpensive. If we use those same concepts in healthcare, insurance premiums would go down, the cost of healthcare would go down, out-of-pocket costs would also go down, and we'd actually have a much more efficient system.
I like that. The problem is it's coming from you as a doctor and not from a legislator or somebody who can actually implement something like this, or at least work with the insurers over something like this. Doctor, hang on for a second, if you would, please. I got to get our traffic and weather. We'll finish this up in a moment. Dr. James Pinkney, Diamond Physicians, joining us. Dr. James Pinkney continues with us for just a couple more moments with Diamond Physicians. Doctor, the model you kind of laid out there, you talked about one monthly expenditure for holistic care, no matter what you need, however many sessions you need, whether it be acupuncture or chiropractic and whatnot, and then you use your actual regular insurance for catastrophic events and situations. I like it. Is that something that has been proposed by anyone in a position of authority, whether it be with the insurers or whether it be with government?
Well, I'm working with Chairman Pete Sessions and Senator Cassidy on what they're calling the world's greatest healthcare plan. And it doesn't lay out the specifications for membership medicine that we just outlined, but it is talking about an HSA credit that if you do have a insurance plan that is credible, then an individual will receive a tax credit of $2,500, and the spouse will receive $2,500, and each dependent will receive $1,500, and that goes onto an HSA, a Roth HSA, and can be used for these modalities that we've talked about. And I think that's a great step. It will help reduce out-of-pocket expenditures, and that's what it's all about. The American people, with the Affordable Care Act, have been forced to buy a subpar product. Insurance premiums are going up, out-of-pocket expenses are going up, and we're going in the wrong direction. So I think it's a good step.
It is a good step indeed, but obviously these things are long journeys, and it needs to be many steps, obviously. Last thing, real quick, people who are using the Obamacare insurance by way of the exchanges, do they have any coverage at all for these types of modalities we're talking about?
No, unfortunately, they don't have hardly any coverage, and the problem is these insurance deductibles are rising. So if you have a $6,000 deductible, you're out of pocket for everything under $6,000 before you even get started. 93% of the population do not hit a deductible of $6,000 or more. So, insurance is great for catastrophic things, but remember, it does not guarantee you access to health care, and that's why direct primary care and membership medicine practices like Diamond are so important for help mitigating individual risk. Because you're out of pocket. So with Diamond, you're going to receive unlimited visits, no copay, 24/7 access to your doctor, 80 to 90% off labs and imaging. So that's very important if you have one of these $5,000 or $6,000 deductible plans.
Yeah, well, it's good to know they made health insurance so much more affordable, which is what we were told it was going to be 4 years ago. And I say that tongue-in-cheek. You don't have to respond. Dr. James Pinkney, Diamond Physicians, online at diamondphysicians.com. Doctor, thank you so much. We appreciate it.
Oh, thanks for having me on the show.
You got it. Have a great day.
It is now 6:04. Obamacare. It was supposed to make health care more accessible, more affordable. Yeah, you got to keep your doctor, remember? But KTRH's Cliff Saunders live now and says that hasn't happened. And now most of you are looking for alternatives.
Yeah, like non-conventional health care, for instance, hypnosis, acupuncture, and even chiropractic care. You're spending $30.2 billion a year on it. And Dr. James Pinkney at Diamond Physicians says the current system needs to change.
It tells me that our current system is antiquated and terrible customer experience. So consumers are seeking different modalities of health care because primary care right now is based on insurance.
He says the money is being spent because you're tired of sifting through a red tape just to see a doctor.
If you can't get in to see your doctor, why not try something that you're going to make an appointment the same day? It makes perfect sense. Now, you just want to be careful with who you're going to for these different ancillary services.
Now, that $30 billion number, Shara, it sounds big, but compared to the $328.8 billion you're spending each year on conventional health care, maybe not so much.
Wow. That boggles your mind. Those who collect Social Security will get a small increase in 2017. The cost of living adjustment, known as COLA, forecast to increase 0.2% next year. Average recipient getting an extra $2 for each $1,000 they collect. There's no COLA increase in 2016, and that's the first time that happened in 4 decades. Medicare's Hospital Insurance Trust Fund, by the way, the bad news keeps coming. It's scheduled to run out of money in 2028, and that's 2 years earlier than previously forecast. It's now 7:05. We all know that health care costs a lot of money these days. Affordable Care Act, Obamacare, not necessarily affordable. And the prices are climbing there, too. KTRH's Cliff Saunders live to say many of you are having to look for different forms of health care.
And not afraid to spend on it, Shara, paying $30.2 billion each year on things like hypnosis, chiropractic care, and even acupuncture. Dr. James Pinkney, a concierge doctor at Diamond Physicians, explains why.
The average wait time is 45 to 60 days, and you only spend about 8 minutes with your doctor. So that tells me that consumers are willing to pay additional funds to actually have immediate care.
Saying that if more of you went to a concierge doctor, you might not be looking for alternatives.
Membership-based practices are the future of healthcare in this country. One low monthly fee, unlimited visits, no copay, 24/7 access to your doctor, and then your doctor can be your healthcare CEO and kind of facilitate what other health modalities you need to investigate.
Oh, and that $30.2 billion number we mentioned, that's just a fraction of what you spend on out-of-pocket healthcare costs. That number, $328.8 billion.
After a while, the numbers just don't even sink in anymore. Thanks a lot, Cliff. Social Security recipients are going to get a small increase in 2017. How about that? Trustees expect a 0.2% increase in the cost of living, or COLA. It amounts to about $2 for someone getting a $1,000 check. There was no COLA increase, though, in 2016, and that's the first time that's happened in more than 40 years. The trustees also projected, though, this is bad news, Medicare's Hospital Insurance Trust Fund, it's going to run out of money by 2028. That's 2 years earlier than they previously predicted. A new report says former employees at Houston VA clinics manipulated patient wait times and cancellations to give the impression of improved performance. A review by the VA's Office of Audits and Evaluations shows that patients who rescheduled their appointments waited an average of 81 days, a lot longer, like 70-something days longer than the data that was being shown in the electronic scheduling system. Local VA officials say manipulation was not intentional. They blamed it on faulty software.